Hi everyone, welcome back to the episode of Ask Dr. Nick. My name is Dr. Nick Schmidlkoffer and I work for the Neurologic Wellness Institute. And on today's episode, we're going to answer the question, why do we make you dual task in assessment and training of a concussion? And this is basically another word saying, why do we make you say a bunch of letters like the ABCs or every other letter of the alphabet or every other month of the year while we're assessing you and during different forms of treatment. And the reason why, because everyone always asks, is because by dividing attention or by dual tasking, it is going to be able to take different parts of the brain and maybe have one of them break down. So basically what happens is after a concussion, after inflammation from an infection, dual tasking is going to be altered because a lot of times the brain knows how to compensate. The brain is able to take what it is dealt with the injury or the inflammation and compensate for the discrepancy. And so when testing for concussions, sometimes it's difficult by just looking at posture and walking speed and gait and stability. But if we use dual task, we can pull out some of these deficiencies by taking away the compensation. So we're just going to look at a quick article that looks at why we do this for concussion. So if we get into the article, this is by in the Journal of Concussion. It's called Using Concurrent Gait and Cognitive Assessments to Identify Impairments After a Concussion. It is from 2017, or I guess published online in 2018. In the abstract, the main thing here is that both gait and neurocognitive evaluations demonstrate utility in understanding and evaluating concussions. And so they basically describe here how combined gait and cognitive, so dual task, as well as single task gait and cognitive examinations can assist in clinical decision making and basically diagnosing a concussion. So if we just skip right down to the dual task, what this says here is that concurrently pairing a cognitive and motor task such as gait together may allow for detection of deficits that are not identified through a single task or cognitive testing alone. And this is obviously very important because, like I said, concussions, people with concussions, the brain learns how to compensate. The process of combining two forms of testing has been termed dual task and has been used traditionally to assess health status progression among the aging population and risk of falling. So this is why we do it with every single person in the office, not just people with concussions, because it can assess more than just a concussion risk or a concussion diagnosis. In the injured brain, this competition may result in degradation in either one or both domains when completed concurrently relative to an uninjured or otherwise healthy individual. And those who reported a history of concussion had a more difficult time dividing attention between two tasks relative to their peers with no concussion history. So basically, having a previous concussion can cause dual tasking issues later down the road, like farther down the road, even without having a current concussion. And again, dual task function after concussion therefore constitutes the combination of two aspects that may assist in outlining and evaluating the efficacy of future randomized controlled treatment and rehabilitation. So if we go down here, they kind of discuss all these different possibilities that you can do: dual tasking with gait, dual tasking with other forms like balance, with maybe moving an arm or leg a specific way. But if we just look at their basic conclusion and executive summary, we can see that in the executive summary, no single test will provide a perfect sensitivity or specificity to identify concussion-related deficits. However, dual task gait tests combine a cognitive and balance test simultaneously that potentially allow clinicians to better detect subtle concussion-related impairments. So if we come back, this is just showing you basically why we make you say things during rehab. During assessment to test these subtle differences. And if you have problems with this, once you get good at the things that we are training during rehabilitation, we may ask you to do more cognitive challenges while we are doing a motor task, this dual task, so that we can better solidify these good connections that we started to build during the first part of treatment, first part of the rehab. So if you have any questions or comments, I'd love to hear them. If you have any suggestions for future topics, please leave them below. Thanks again, and have a great day. Stay healthy.